We might make it.
We should go.
Put the address down. I'm going to this game. We're going, Maddie.
Go.
I'm picking you up from school. We're going. I gotta see this.
Bye.
Bye. Have a good day, guys. My job as a case manager is to see that patient however many times a week it requires, stay in communication with the physician, to draw labs, to monitor the patient's labs, and of course if the patient has any wounds, which typically if they come home on IV, they more than often will have a wound that we're treating for infection. So we also do traditional wound care along with the IV.
This is kind of our storeroom. You can come and get all of our supplies here. This is Dave, our storeroom guy. So any type of wound products we need, anything we need, we come here and we can get everything we need to, take it to the visits. So, give you this, Dave. Thank you.
You're welcome. Have a nice
You
day.
too. Hi, Marguerite. It's Brendan, the nurse. How you doing? I just met you. Good. I wanted to come see you a little sooner this morning, if that's okay. I was hoping to come between 9:30 and 10. Is that all right? Okay, great. Thank you. We start our day in the morning by kind of having an idea of who and where we're going ahead of time. It's up for you to plot them out and know who needs to be seen, when and where. It's part of case managing. That's what we do. A lot of people tend to have visits Monday, Wednesday, Fridays. We do a lot of wound care, and those are the days we do a lot of bandaging. Some of these patients you get to know a couple months at a time, and it's a very personal relationship.
Oh my God.
Oh, I missed you.
We've been.
Oh, I've been so sick.
Yeah?
One
Can you-
full week, a week today.
Any more increased shortness of breath lately?
I really do have love for the people that I see, and that's a reward in itself. I mean, a lot of the time you go into a room, people are sick, they're not doing so well at the hospital, and they're not happy to see you. Very rarely do I have a case where my patients are not happy to see me. I feel really close to them, and it's more like going out to help a grandmother or an aunt or something like that. It makes you want to just fight that much harder for the people around you.
She got confused and she fell twice on Saturday. Her legs are blowing up. She's got blisters on her feet. Oh, she's a disaster. Yeah, I called, I can't tell you how many doctors. Her nephrologist is in on it, the surgeon, the infectious disease, her primary. I had to call all the doctors. I'm coordinating 4 different doctors. It's ridiculous. Yeah, it's a lot of work on her case, make sure they're all informed. But all right, honey, I will give him a call when I get to the office a little bit later. I know they have those funny phone hours anyways. They're not open. 10 to 20 at least. Yeah, I've already, made 5? Pretty much my entire phone bill is used for work and it's reimbursed. They also reimburse us for our mileage, and I'm usually between 2 and 3 hours of drive time. I try to get most of my charting done in the home. So maybe when I get home, I might have an hour of charting to do. So you're taking almost 3 to 4 hours out of your day for drive and charting. That's why the IV team only typically does 4 visits a day, because our patients are a little bit more involved. We have more than, typically 1 task at the home at the visits. And if it's an open for an IV patient, we're going there for the first time, the majority of them are 2 to 3 hours that you're there with the patient. And it's a lot of information at once. And that's why we go back the 3 days afterwards, just to make sure they're okay.
So this morning you're going to set it up and I'm going to watch you. Don't be nervous. I just want to make sure you feel comfortable doing it. Use the whole thing in between each drug. You want to clear out your whole PICC line before you start a different medication. Okay. I see George taught you well. He did. Usually at the first visit, we make sure they can at least change the bag over if they're a every 8-hour or an every 12-hour dose, and they can know how to disconnect and flush. Some people can't even do that, and we have to go back at night and re-instruct it again. Some of them try it, and if they get stuck, they call the on-call nurse. You know, we all have our turn that we're on call, and then we have to help them either over the phone. If they can't work it out over the phone, we need to go out and do the visit. So, but she did really well. She was only taught yesterday. She did her night dose herself, and she just performed the whole thing this morning. So she's good. If she didn't feel comfortable, though, I would add another visit, and I'd go back again in the morning and help her again. But she did really good.
He texted me a picture and said, "You're a girl," and she.
So it says regarding HHA, there you go. Like diabetic, oxygen safety, falls risk. And then we also, introduce the client to the aid. And if you highlight her and go to notes, you'll find the reason why they want us in. Normal orientation, I think it's 16 weeks, but then we flex that based on the orientee's needs and how much they've, done home care before.
You're not a case manager really in the hospital. You have people who do that. You have a physical therapist who will come and evaluate the patient automatically. Here, as a nurse, it's your responsibility to bring physical therapy in. It's there at least 2 or 3 times a week. The doctor will be in to see the patient. In home care, you are the eyes of the doctor.
In the beginning, they actually come around with you and they just watch you for the first couple of weeks. And then you start to let them participate a little more and you're watching them. Lots of skills, because in the hospitals you're not doing these things we're doing in the home. There's a lot of things that just different wound cares, dressings, and lots of teaching.
It's very important, your teaching techniques and getting them comfortable to be able to do these things at home and to keep them out of the hospital.
We're shaping the way the healthcare in the community is, because even to some doctors it's relatively new. And a lot of the patients, the capabilities that we have are relatively new. They're surprised at some of the things we can do in the home. So it was just fun and exciting to be a part of that.
Personally, I feel that this job is the most rewarding job I've ever had. It gives me a warm, fuzzy feeling to see the patients back to doing what they should be doing, out shopping, performing their ADLs, spending time with their family. So I get to see the end result. We're a nurse in the hospital, you discharge that patient and you probably never see them again. Where I see them out in the community and know, wow, I really did make a difference. I was able to get them back on their feet along with other clinicians, physical therapy, occupational therapy, the doctors, and the patients are always very appreciative, and they tell you at every visit, thank you for coming. You're doing a wonderful job, and it is very rewarding.
They all share what they've learned over the years to make things easier for the patients, truthfully, and for themselves. 15 years they've been with me, and it's a difficult team. Very difficult, very sick patients, the acuity, and my nurses are the best, and I love them all. It's amazing, really. Selfless.
No, there are no brains.